is the Chief of Staff for Governor John Bel Edwards. Hey, Mr. Mark, thanks for taking time. Welcome back to Kiel. How you doing today?
Hey, good morning.
Mark, let me ask you this. There was a Department of Health doctor who talked about there were discussions about going back to phase 1. I don't know if you've been able to run that down or not, but is there any truth to that at all? Did anybody, he said, he used the term state officials, have any discussions about going back to phase 1?
Well, let me just say, Aaron, you're the one that brought that to my attention, and I know as far as the governor's team and as far as the Unified Command Group, and that's made up of the governor, his key cabinet level officials, there has not been any discussion about going back to phase 1. So I appreciate you bringing that back to my attention. So I chased that down, and I think that was at the regional level that person was having conversations probably with his team, but that was not with the individuals making decisions or the leadership making decisions. So he was spoken to and was, made sure that he does not make those statements on behalf of, the officials that are responsible for making those decisions. So the answer is no. There's not been any discussion about going to phase 1.
Mr. Marcus,
is it an option, though? Is it an option on the table that maybe could come up?
Well, obviously that's always an option, but it's not being discussed. I mean, our plan, and that's why the governor is staying in phase 2, is that we're and we're stepping up some of the enforcement. When I say enforcement, going to businesses and talking to them about making sure employees are wearing masks, et cetera. I mean, our plan is to stay in phase 2, just like Texas is doing. In fact, Texas has gone back, not allowing elective surgeries so that we can tap down these numbers that are increasing so that we don't have to do anything else and move forward to phase 3. But I guess that's an option, but I don't think we're going to have to do that. Our plan is to move forward. I mean, I don't think people in Louisiana want that to happen, and we don't either. I think we need to move forward.
Sounds like the way you're talking that the governor and everybody is really locked into phase 2 till at least the 24th. There's virtually no chance at all of maybe lessening restrictions a little bit before the end of July.
Well, I think that's what the problem is. During the press conference, the governor made the statement that we'll look at this again in 2 weeks and then again in 3 weeks. The reason he said that is that we don't want the citizens of Louisiana to think he's going to wait till the 28th and then make a decision. The reason he wants to look at it 2 weeks from now is to see if things improve, to see if we can lessen restrictions in 2 weeks and then again in 3 weeks, and not just wait until 4 weeks from now. That's why he made that statement. So to answer your question, Robert, there's a possibility in 2 weeks if things improve, we could actually lessen restrictions. That's why he made that statement during the press conference.
Mark, it troubles me a little bit, and I know probably you and everybody making these decisions, that on the 28th, we're less, at that point in our area, Caddo Parish, we're less than 2 weeks from opening school. And that seems really to be pushing the envelope in terms of what will the school day look like if we don't know at that point 2 weeks out if we're in phase 2 or phase 3 yet.
It's going to be a challenge, Aaron. It would be a big challenge if there was no planning taking place, but the school systems and the state have been planning for some time. In fact, the governor has been having meetings, and we had a big meeting that occurred at the beginning of the week with the new superintendent to look at their plan, and they released what that plan was. I believe that was on Tuesday. I'm losing track of time. So they've got plans in place, and they've been meeting with the local superintendents. So they've got a plan in place they can execute. I mean, it's not going to be perfect because we are in a pandemic, and every state in the country is dealing with this. So the fact that we have a plan in place and they are working and they are planning should make our citizens feel comfortable that things are being done so that we can when the timing is right to execute that plan.
You talked about meetings between Dr. Bromley and the governor. When those meetings were taking place, when the plan was presented, I assume, by Dr. Bromley to the governor, what kind of imprimatur, what kind of approval authority does the governor have, and how much input did he have into the plan that Dr. Bromley just released?
Well, they've had conversations. When he was appointed, there was a meeting that took place, and generally the governor spoke to him about expectations. But again, he's independent. And then the meeting that took place this week was a culmination of things that have been of meetings that were occurring and conversations that had taken place during Unified Command Group meetings since March. And he basically presented what they were looking at, and the governor did have some input, but, it was along the lines of, what the CDC had recommended and, along the lines of what the governor and what we've been talking about as far as guidelines for businesses, et cetera, masking and looking at what would be expected in the classroom, and also looking at online learning if it's part, some, and the other part of it too is that some districts may be at a different point than other districts are, and what does that look like? And also looking at some areas may have better access to online learning than others, and what does that look like, and making sure that kids that don't have, and one of the things that we're working on right now is making sure that all kids have online learning. But if that's not the case, is there phone calls that can take place? Is there things we can do on cable? Is there things we can do on radio? So he's doing a very good job, him being the new superintendent, to look at all aspects, when schools do open up, that we can look at all different scenarios. But it's not going to be perfect, and you wouldn't expect it to be in this type of a situation.
Let me ask you a question too about the different phases and the implementation, and the cases. We've seen spikes in many states, and we've seen spikes. We had the deal at Tigerland. Can you attribute what you're most concerned about to any one or two particular things? And then we also have to ask you about the protest. Could that have played a part in what we're seeing as well?
Yeah, so right now, obviously the numbers still were, I think I'm not going to say the majority, but the concern right now is the younger folks, and I think the numbers we're looking at are 40 and younger, maybe 30 and younger. The Tigerland incident, I think I was reading an article yesterday that showed that they've had 100 cases attributed to that. In the paper today, in the Advocate, the concern now is those younger people are going to go home and to their parents and to their grandparents, and we may see a spike going back up to the older generation. That's going to be a concern. Certainly protests, fortunately we didn't have here in Louisiana what the rest of the country had. That's got to have an impact, right? And I guess, Aaron, that's why, we're concerned about what Representative Seabaugh is doing. It's kind of reckless, trying to take away the state's power to and take away the public health emergency. And why it was troublesome for us, when he was on the steps of the Capitol yesterday with a group of 21 legislators not wearing a mask, when we're now trying to get young people to wear masks. That's troubling, and we don't think he's going to be successful. But yeah, I would say that the younger generation, that's what we're trying to target. We're trying to step up communication. But we need everyone to join us because, we want to move forward. You talked about opening schools and opening universities, and we want to expand what businesses can do, and we want to have LSU football. That's not the number one priority, but we need something to boost people's morale. We know people are, depressed and are tired of this, but it certainly doesn't help when you have one of the leaders up in your part of the state and my hometown, trying to take away the state's authority. It's almost like what's going on in Seattle with the no police zone. We would be one of 49 states if he was successful to not have a public health emergency for the state or take away the state's power. I mean, think about that. One of 49 states.
Just to clarify, Mark, you're comparing Alan Seabaugh right now this morning. You're comparing his legislative, or the threat perhaps too strong a word, the shadow of his legislative proposal to overrule the governor's stay-at-home emergency. You're comparing him to the CHOP group in Seattle.
No, that's a tongue-in-cheek comparison. I mean, it's kind of an exaggeration, but I'm just saying that it's just, you think about that, we would be one of 49 states if he was successful to take away the power of the state to for a public health emergency. It's a tongue-in-cheek comparison, but it's similar in the sense that we would not have the authority to do the things that we're doing to protect the people of Louisiana as it relates to public health.
Mark, we're talking to Mark Cooper, the governor's chief of staff. One more. We hear a lot of people say it, so I'm going to say it directly to you and see what you say. We're staying in phase 2 because we get more federal money if we continue in phase 2. Please address that because people are saying it all over our state.
Yeah, that's not accurate. That this has nothing to do with the funding that's coming from the federal government. It's based on the number of cases. It's based on population. You know, they're looking at another stimulus package right now, but it has nothing to do with the phases that you're in. It's going to be looking at economic impact. It's going to be looking at dollars that are spent. It's looking at a number of factors. Look, we want to go. I mean, it's always a gut punch when we're in these meetings and we're looking at the numbers, and no more than to the governor who wants to. We want to get out of this, and our hope is that in 2 weeks, if not then 3 weeks, if not by the 28th, that we can make an announcement that we're going to be in phase 3, that schools and universities can open, that businesses, we can expand even more than what we're doing, that we can move forward and all that. And again, I would just hope that Representative Seaball, that he would see that what he's trying to do, and again, we don't think he has the votes, and Dodie Horton and the others that are up there that are behind him, that they would just join us, and you know, we can move forward and encourage young people to wear masks, and they certainly didn't do that yesterday on the front steps of the Capitol. That we all need to work together and move forward and get businesses open, and so that people can go to nursing homes to visit their elderly, because that's the other thing that's, you know, people that are suffering. And I think it was yesterday was an insult, you know, to folks that are trying to move forward by just standing on the Capitol, all 21 of them, with no masks, taking a picture. It was an insult to the healthcare workers, to all that are trying to move forward with what we're trying to do.